There seems to be some confusion with what a pap smear is and a pelvic exam. It might be confusing because it feels the same. Essentially, we use a vaginal speculum to take a look inside. A pelvic exam typically is just like looking around any abnormal cells or tissues or growths. Is there any abnormal discharge? And we might take a swab or a sample at that time. A pap smear is when we use a brush to collect a sample of tissues from the cervix and send it to the lab and check for cervical cancer. This is done every 3 to 5 years, depending on how old you are and whether or not you get HPV testing. HPV is a virus that is highly linked to cervical cancer, and it's a major risk factor. And if that is all normal, you're good for 3 to 5 years. And if things are not normal, depending on the results, we'd have to check after a few months to a year, or we may have to send you to get something called a colposcopy. It's when you essentially look at the cervix under a microscope, like it's magnified, put some dyes on there, and it highlights any abnormal tissue which would get biopsied. These abnormal tissues would get biopsied and sent to the lab for further investigation.